Good morning. I wanted to talk about how opioid overdose works and why so many people are dying from opioids. 100,000 per year is the latest numbers that have come out, which is just such a frightening number. Opioids are fabulous drugs in medicine. They're great painkillers, but when I was in medical school, one of the big things they taught you was that the big side effect is that they go to the part of the brain that controls our breathing and shuts it down, or it slows it down at medium doses, and if you go higher and higher on the dose, it slows it down so much that you eventually stop breathing. And that's what happens in an opioid overdose. So it's just an unfortunate side effect of the opioid class of drugs, and all opioids do it, and the higher the dose you go, the worse it happens. So if you think about what's happening if somebody uses heroin or fentanyl or any kind of opioid, if they use a dose that gets them high, they're still breathing, but if they use a bit more, they get sleepy, and then they get more sleepy, and the breathing starts slowing down. So instead of 20 breaths a minute, maybe they're down to 10, and then it goes to 5, and then maybe 4, and eventually it stops altogether, and of course they die. But oftentimes there's a long period where they're still breathing just enough to survive, so people should have Narcan around. I mean, it's just life-saving medicine that should be readily available to everybody. And a lot of people are saying everybody should carry it. And if you carry it, not just for yourself, but for, if people are using drugs, that you might just come across somebody who needs it. And so even if you think the person's gone, it's amazing how many people will come back to life because they're actually breathing 2 or 3 breaths a minute, which is just enough to keep their brain alive. And then they will survive. So Narcan's incredibly powerful. Second thing to know is that there are actually 2 breathing centers in the brain. One is shut down by the opioids, but the other is slowed down by any kind of sedative. And that includes alcohol. It includes benzodiazepines particularly. So if you're slowing one breathing center down with the opioids, it doesn't take much of the benzos or alcohol to slow down the other one, and that's a fatal combination. So most overdoses actually happen with the combination of both opioids and a sedative drug like alcohol or benzos. So, boy, anybody who's using opioids should absolutely avoid sedatives. It's just a very dangerous combination. Third thing, fentanyl is just even particularly worse because it's so powerful that it shuts the breathing down much faster. And anesthesiologists used fentanyl for quite a while. I'm not sure if they still do anymore in the ER and in the operating room. And they noticed that some patients, if you gave the fentanyl too fast, it would actually have a weird effect where it stops the chest from moving. I think it's called wooden chest syndrome. And it would be so powerful that they wouldn't be able to even use an ambu bag and actually ventilate a patient because the chest would be so rigid. And so that seems to be happening with some patients who are dying from fentanyl overdoses, is that the fentanyl just stops the muscles from moving at all, just a horrible thing, and so the patient dies instantly, and there's almost nothing you can do. They're horrible drugs. Please get off them. Please get some treatment. Please either get on some form of medication-assisted treatment, Suboxone, Sublocade, or, we can help you get onto long-acting naltrexone so that you can lose your cravings and actually start living life again and start getting back to normal.